Good afternoon. I often get asked whether long-acting naltrexone really does eliminate cravings for opioids. And that has been pretty much our experience where, of course, eliminate's a strong word where there's no cravings at all, but almost all of our patients are amazed at how low their cravings are when they're taking either Vivitrol, the 1-month injection, or the implants that we use, the naltrexone implants that last 2 months. And I get asked that question a lot because obviously people who are trying to recover from opioid dependence do a lot better when they aren't craving it really strongly. And there's a belief, I think, in the main medical community that have never used long-acting naltrexone that oral naltrexone, the 1-day pill, actually doesn't decrease cravings at all. And I have to say I found that true. So it's not really the naltrexone itself as the molecule that seems to be decreasing the cravings. It's the fact that we've put it into a long-acting form. And when you think about it, that makes sense, because when we give somebody a 2-month naltrexone implant, they know up here that they just can't get high at all. Even if they go buy some street drugs, and we've had lots of people try it, they come back and say, well, it just did nothing. I couldn't get through to the receptors. You understand that the naltrexone blocks the opioid receptors, so then the heroin and the drugs that they're taking can't get into the receptor, and so they have no effect at all. It's like taking a sugar pill. And so they know that, and so then they stop thinking about it. When you think about cravings for anything, the access to it is kind of the ability to get it is kind of the important thing. You know, we've all had the experience where we were on a diet or not trying to eat too much, and then somebody brings along some donuts or some cakes or some Dorito chips or something that we know are going to taste down delicious. And all of a sudden we have what are essentially cravings. Why? Because they're sitting right there. They've reminded you that they're there, that you know they're there, and you have access to it. You could take them if you want to. So it sets up this internal debate where, I could have it, but I shouldn't, but I don't want to, but yes, I do. So that's what cravings are all about. As soon as we put people on the implant 2 months, they just don't think about it. Their cravings start coming back on about week 7, because then there's only 1 more week to go before they could get high if they don't come back and get their next one. So we work hard to make sure people come back and get their next treatment. The oral tablets almost seem to make the cravings worse because it's only 1 day, because they take the pill and then within 24 hours it's worn off. And everybody can wait 1 day to eat that chocolate cake or that ice cream that's sitting in the fridge or whatever it is. And so people with a drug addiction, they can easily wait 1 day to get high. So it almost reminds them when they take the pill that they could get high tomorrow. And that kind of drives people a little bit nuts. So most people stop taking the pill very quickly. But the long-acting naltrexone, very dramatic craving reduction. So if you do need help with your opioid dependence, or you know anybody that does, please get them on treatment soon.